favorite teen show. My name is Brittany. This is RTT, Real Teen Talk. Last episode we discussed about teenage pregnancies and we saw the effects on it, and we are going to make sure that we educate the community. Today's topic is drug abuse and addiction. I'm going to discuss it with Dr. Brayton from Nesco Hospital and a student here called Brenda. Dr. Brayton.
Yes.
How are you?
I'm doing great.
Okay. Brenda.
Yeah.
How is this time of corona taking you back at home?
It's great.
Okay, thank you very much. So today we're discussing about drug abuse and addiction. I want the first question to go to you. Is that okay with you?
Yeah, it's okay.
So I want to tell us what exactly is drug abuse.
First, I would like to start by introducing myself. My name is Brenda.
Yeah.
I'm 14 years of age.
Mm-hmm.
I study at PCN Muni Primary School. And going back to Brittany's question, drug abuse is the excessive use of drugs that you cannot do without and it may cause addiction.
Thank you. That's a good thinking. Dr. Brighton,
Yes.
according to your perspective,
Yeah.
I want you to give us a deeper explanation about drug abuse and addiction.
So thank you very much for hosting me, Brittany.
Okay.
And my name is Dr. Brayton Mwenda from Nesco Hospital. And I'll just add a little from what Brenda said. A drug is any substance that when taken affects the normal functioning of the body, mind, or both. And drug abuse is the excessive use of the drug, which may eventually lead to addiction. And the commonly abused drugs in Kenya is bang, mandrax, and cocaine.
Really?
Yeah,
Okay.
even tea and coffee are drugs because they contain caffeine in it.
Oh,
Yeah.
do drugs affect only mentally?
No, in my first statement I said a drug affects the body and the mind. Yeah.
Okay, thank you very much. Brenda,
Yeah,
have you ever met drug addicts on your way, maybe going somewhere?
absolutely.
So I want you to imagine a case whereby they are your best friends who you can stick on in times of sorrow, maybe even happiness. So I want you to imagine they are best friends. So how would you try overcoming the peer pressure they'll be giving you, like, come, let us do this, we'll show you how to do it, it's fashion nowadays. How would you try giving out overcoming the peer pressure?
I'll try to give them a piece of advice. Or if I won't be able to do that, I'll ask for someone elder to help me. Maybe you can take them to a rehabilitation center. Maybe there they can reform and be people to associate with.
Okay, thank you. Dr. Brighton,
Yeah.
you're a doctor.
Yes.
So I strongly believe that in your hospital, is that corona?
No, it's not.
I
I thought it was corona.
same.
So I strongly believe that in hospital you've dealt with a lot of cases dealing with drug abuse and addiction.
Yeah.
So how do you deal with each and every person using drugs out there? Because I know most of them are rude.
No, that's always the notion to everyone.
That's what I believe.
Yes, at times they are rude, but the rudeness is not that it's for them they want it's because of the reaction because of the drugs they have taken.
Okay.
And the rudeness comes because of the addiction that they are in, the drug, especially the teens who are not, they are so moody. So together the drugs, they are so rude. Yeah.
Okay. Thank you very much. Do you have rehabilitation centers?
Yeah, we have next to the Nesco Hospital.
Okay.
Yeah.
Brenda,
Yeah.
you're a junior teen. You said you're 14 years. That's a junior teen. Okay, so what advice would you be giving to the teens out there using drugs?
I would like to tell my fellow teens to abstain from drugs because drugs might be harmful to your health. And at this time of corona,
Okay. Brighton, you're a doctor.
True.
And I believe it's by profession.
Yeah, I'm a professional doctor.
Thank you for that.
Yeah, I'm professional.
Okay, so what advice would you be giving to the teens out there using drugs as a doctor?
Mm-hmm.
Not only teens, but anyone who uses drugs.
So as we conclude, my advice to those who are watching us, especially mostly these drugs affect the teens. My advice is that parents and the community at large, let's help the teens to eradicate drugs in them. Let's train them. Do not deny them. Some of them are your parents. Some of them are the kids. So, like me, for example, I have a friend of mine. His child is a drug addict in alcohol. He takes alcohol. So when he came to Nesco Rehabilitation Center, he changed. We gave him some acceptance. Not the first thing to healing is accepting.
Accept the person.
Yeah, accept the person how he is, and the person himself should accept that I am a drug addict. That will be the best thing. Then you take him to the psychological momentum. Then from there he will catch up, and from a year or two, the patient will be alright. And now my friend's son is doing great. He's now doing during this time of corona. The child is doing great. He's keeping himself busy. Yeah, to not join himself to drugs. Thank you.
Okay. Thank you very much for watching this favorite teen show of drug abuse and addiction. See you next time.